for everyone. And I'll just give us a little housekeeping as an intro. So today, if you're joining us live in the webinar, everybody's cameras are off, you're muted for recording purposes, but we would love to have you engage with us in the chat. So if you have questions, feel free to throw them in there. My coordinator here is going to help me stay on top of the questions in the chat. And we just want to also give you a little bit of a warning, a trigger warning. So we want to acknowledge that this topic can be sensitive and potentially emotionally impact some individuals. So we encourage you to prioritize your emotional well-being. It's entirely okay to step away from the conversation if this becomes triggering for you. We are recording the webinar, as I said, and we will send out some slides as well. So if you want to engage with this at a time where you feel more comfortable, we absolutely support that. So thank you again for being here. And one more note, as we introduce some research topics today, we just want to highlight that this program is for everyone. And sometimes in our research articles that we have, the information is gendered, but we want everyone to know that this is definitely a program that any expectant parent can use. So thank you to the Anthem Foundation. We're going to introduce our special guests here in a second. One of them is associated with the foundation, and we want to give them a huge thank you for opening the state of Kentucky for this information, this really important campaign. So I am Sarah Coleman, and I am the State Expansion Director here at Healthy Birthday. Count the Kicks is our educational campaign, and I am joined today by a few people, so I'm going to roll it over to the first person who shares the same name as me, and that is Sarah Hybels.
Hi, everyone. I'm Sarah Hybels. I'm the State Expansion Coordinator for Healthy Birthday and Count the Kicks. I've been with the organization a little over a year now, almost a year and a half, and I'm so excited to talk to you today about our programming and launching with all the amazing organizations and providers there in Kentucky. So thank you for being here.
Thank you, Hybels. We also have joining with us our medical director, the Plan Performance Medical Director for Anthem Blue Cross Blue Shield, and that's Dr. Lori Kaloya. So we'd love for Dr. Kaloya to be able to share a message with us as we get started today. Dr. Kaloya?
Sorry, it took me a minute there to get unmute on my phone, unfortunately today with some IT issues. So thank you so much, Sarah. My name is Lori Kaloya. As Sarah said, I'm the Plan Performance Medical Director here at Anthem Blue Cross Blue Shield in Kentucky. And we know there are many ways that you could be spending your time today. And we appreciate that you are taking the time out of your busy schedule to join us here today. It is testament to how important this topic is that you're here with us today. We at Anthem are proud to be a part of this partnership to launch this evidence-based stillbirth prevention program here in Kentucky. Unfortunately, the stillbirth rate in Kentucky is at 6.08 per 1,000 live births. For comparison, the US stillbirth rate is 5.73. We believe that we can lower that rate by working with you, our state partners, and with Healthy Birthday, Inc., the nonprofit organization that created Count the Kicks stillbirth prevention program. Count the Kicks is proven to improve birth outcomes for moms and babies. It's a simple and non-invasive way to monitor a baby's movement every day in the third trimester of pregnancy. Thank you for spending the next 60 minutes with us and learning about how you can implement what you learned today in your hospital, clinic, or organization. Over the next hour, we'll discuss how we can work together to reduce the stillbirth rate and improve birth outcomes for families in Kentucky.
Thank you. So, Hybels, I'll let you cue up our video.
Okay. Thank you. So let's learn a little bit about Count the Kicks and the impact it can have. This is a true story of an Iowa mom who used our program to help save her baby's life.
We have a healthy baby girl, and we could have had a burial instead.
Ruby is lucky to be alive, and her mom says that's largely thanks to an app. The free app called Count the Kicks aims to prevent stillborn deaths by helping moms record their baby's movements.
You can just tap the baby's footprint every time you feel a movement. A movement could be a kick, a roll, or a jab.
Used at the same time every day, the app tracks how long it takes to reach 10 kicks, helping mom learn what's normal for her baby.
And we also send calendar reminders and text reminders so that moms are reminded to do it once a day in the 3rd trimester.
For the Ecoffs, everything was going smoothly until one day last month.
The kicks were not happening as frequently as they usually did. And when she did move, it was really like soft, subtle, not like hard kicks like normal.
Emily knew from the app that her baby normally kicked 10 times in under 10 minutes. So when she only logged 3 kicks in an hour, she rushed to the hospital.
All of a sudden they came in and said, you're going to have an emergency C-section.
The umbilical cord had wrapped around the baby 3 times, limiting her movement. Doctors delivered Ruby just in the nick of time.
Not only has Ruby been saved, but potential generations have been saved.
And we'll talk a little bit more about that app and other tools for Count the Kicks here in just a moment. But first, I'd like to take the pleasure of introducing you to our Kentucky ambassador, Kathleen Wolf. We have ambassadors all over the country, and these women are boots on the ground advocates. They're attending conferences, fundraising, going to media interviews for us. And so I'd like to take this chance for Kathleen to introduce her and maybe tell a little bit about her story.
Hi there, thanks for having me. My name is Kathleen Wolf and I live in Covington, Kentucky, so in the northern part of the state. And my daughter Margot is actually a baby save as well. She was born in January of 2021 at 34 weeks. And my doctor's office was using Count the Kicks. She was actually born across the river in Ohio, where there is a partnership already in place at that time. So I knew about the app and I was using it to count her movements throughout my pregnancy. And when I was 34 weeks along, I had gone to have a non-stress test and a growth scan, and everything looked great. And then the next day, I noticed that she wasn't moving. And so I thought I was maybe being a little paranoid, but I called the doctor back and they said, you know, have you done your kick counts? And I was like, yes, the baby's not moving. And so they had me go to labor and delivery. And they admitted me at that point. I think my non-stress test and BPP was like an 8 out of 10. So it was a little less than the day before when she had scored 10 out of 10. So they were kind of trying to figure out what was going on. Never really found a reason, but while I was there, she kind of declined pretty rapidly. And they did an emergency BPP where she only got points for having appropriate amniotic fluid. So I got a 2 out of 10. So they were like, okay, we're going to go have the C-section now. And, you know, my husband wasn't there or anything like that. I'm like, can I call him? So it was pretty rapid at that point. But as soon as she was born, they realized that she had a 2-time nuchal cord and a true knot in her umbilical cord as well. So obviously she was struggling and was able to kind of communicate that to me since I was using the app to track her movement. So she is now a healthy 3.5-year-old, very sassy. I just am grateful that I was aware of the app and aware of the program. And so I've just been kind of using my time to help educate other mothers and make sure that they have the same information and the same tools to help learn how to keep good tabs on their baby, and really just make sure that anyone that I talk to has the right information to be able to save their baby as well if needed.
Thank you, Kathleen. We really appreciate you being here and sharing your story. So thank you.
Sure.
Okay, so let's talk about what is Count the Kicks. As Dr. Clea said, Count the Kicks is a highly effective evidence-based stillbirth prevention program. We were founded about 15 years ago by 5 Iowa women, each who had a stillbirth or an infant death. And they have developed a proven warning system for moms, and we have saved lives in 36 states and 5 countries so far. We want you to know that this program is so easy to use. It is plug and play. It's so easy to share with expectant parents. And in this webinar, you're going to learn about the tools and resources that you need to implement Count the Kicks into your work setting. So before we get too much further, let's discuss the tragedy of stillbirth in terms of numbers. So stillbirth is defined as the loss of a baby after 20 weeks in pregnancy. And again, this is definitely a public health tragedy that we are not talking about, where people talk about SIDS and the Back to Sleep campaign, but we're not talking about stillbirth. And it's a lot more common than people think. 1 out of every 175 pregnancies will end in stillbirth in the United States, which means today 60 babies will be born still. And additionally, there are so many disparities that exist that are unacceptable. So you can see some of the numbers here on the slide. And we here at Healthy Birthday and Count the Kicks, we take these disparities very seriously, and health equity is at the center of everything we do in our work. So we want to get to know about your state and about Kentucky and the places that need this messaging the most. And again, it's important for us to understand the impact of stillbirth around the nation, but specifically in the state of Kentucky. So we have gathered these numbers from CDC Wonder, and this data is based on a 5-year average between 2017 and 2021. So as was mentioned before, Kentucky has an average of 325 babies that are lost every year. And we believe with the implementation statewide of Count the Kicks, we can save 104 Kentucky babies every year. But we need your help, and we're going to give you the resource and tools that you need in order to implement Count the Kicks today.
Okay, so let's talk about some of the known causes of stillbirth. So we don't know about any one definitive cause, but research does point us to possible causes and contributing factors. And you can see some of those listed here. Kathleen talked about, failing a BPP test. Sometimes we notice information there that we can gather research information, but other times we don't know. Something that we are seeing a rise in across the United States is the rise in congenital syphilis cases tied to stillbirth. And so this disease, you may have heard of of syphilis before. This is being diagnosed at the highest rate in 70 years across the United States. So during pregnancy, syphilis, which is a sexually transmitted infection, can spread from a mother to her unborn baby, and that can cause what is known as congenital syphilis. So if it is left untreated, it is treatable, but if it is left untreated, it can increase the risk of having a stillbirth. And data shows us that 40% of babies born to women with untreated syphilis can be stillborn or die from that infection as a newborn. So again, that key word there is treatment. And you can help improve birth outcomes and prevent syphilis-related stillbirths by talking with expectant parents about their risk, and then being familiar with the testing protocols for each state and encouraging treatment. So what are we doing to reduce some of the disparities that we see when we talk about causes, when we talk about the equity data that we see? We focus largely our work on being inclusive. We focus on health literacy. Our app is free, 100% free, and Hybels is going to talk a little bit more about that later, but it is 100% free. It is also available in 21 languages. So if you are working with patients who English is not their native language, we likely have a language that will help them understand the information, and the app will be available in that. We make sure that we are working with the boots on the ground in the states. We are located in Iowa. We're working in Kentucky, obviously, for this one. And we meet with those teams in Kentucky. We work with community partnerships. We really want to be informed about what people are seeing so that our work can move forward. So these are the at-a-glance materials. I talked about that health literacy. So our at-a-glance materials they're very heavy on pictures, as you can see from this. It's a pictorial guide kind of to the Count the Kicks campaign. It's a visual way to understand our program, and it helps people understand why it's so important to pay attention to movement in the 3rd trimester. So these materials are available in Kentucky as a part of the suite, and we will share with you some ordering information later, but just want you to kind of get an idea of what this campaign can look like and how it can impact populations. So we talked about the stillbirth rates by race and ethnicity and just how unacceptable that is. We want to close the gap. We don't want to widen the gap with disparities. So let's watch this video to hear another story. You heard Kathleen's story. We're going to hear another story now about this information.
I am so blessed that she got here safely. And I'm so glad I listened to myself this time, and I listened to my body, and I counted my baby kicks. Count the kicks I mean, it helped. It really did. It saved my baby's life. It really did.
She was like, it's a good thing you came when you did, you know what I'm saying? Because if you wouldn't have, you know, we probably wouldn't be having the same outcome. I think about it every day, like, oh man, what if, you know, what if?
So I love that video for a lot of reasons. And before Highballs tells you about our Baby Save Olivia, we do want to acknowledge that for all these babies that you're meeting today that are baby saves, there are babies that are lost and parents that are grieving that loss. And so you're going to hear us talk about how fetal movement can save babies. It is not the guarantee. There is no guaranteed solution to save all babies. But as you heard from Kathleen's story, that's really important. As you heard from Destiny's story, participating in that fetal movement monitoring is a critical piece in stillbirth prevention. So Highballs, let me pass it to you.
Thank you. I'd like you to meet Baby Save Olivia, and Olivia is from right there in Kentucky. And Olivia's mom, Tara, one day noticed that Olivia wasn't moving as much as she thought. She wasn't kicking, she wasn't moving around, she got ready for work, kept monitoring her baby's movements, and still there was no movement. So then Tara advocated for herself. She advocated for her baby. She went to her doctor's office. She got checked out, and they realized that Olivia was in distress and that it was time for her to be born. After a stay in the NICU, she was released to go home and now is happy and healthy. And we are so grateful that baby Olivia is here. And again, her mom was brave enough to speak up and advocate for herself and her baby. And we'll talk a little bit more about the specifics of movement monitoring here in a few minutes. Oh, Coleman, you're on mute.
Thank you. Let me talk a little bit about the research and evidence behind fetal movement monitoring as a best practice in stillbirth prevention. Not on mute, so you can hear me. So the first thing that you're going to learn about today is called the Norway study. So Count the Kicks is based on the research from this study. It was published in Norway in 2007. So in this study, researchers in Norway worked with health systems across that country, birthing hospitals, OB clinics, to educate expectant parents on getting to know what their baby's normal movement pattern looked like. And they were instructed to speak up if they noticed a change. So again, a change can be a red flag during pregnancy. You've heard that today. And it is often a precursor to stillbirth. So by alerting the physician, the midwife, to investigate if a baby is in distress or take action if needed, that's an important part of this campaign. So this work led to a 30% reduction in Norway's stillbirth rate. I'll say it again, that was a 30% reduction over the course of the study in the country's stillbirth rate. So Dr. Ruth Fretz, you see her name highlighted and circled there. She is an original researcher from the study, and she currently sits on our medical advisory board and has advised our campaign since the beginning. Our funders, those 5 women who all experienced loss here in Iowa, saw this study and they decided to try and replicate what they had done in Norway. This is the result of what happened here in Iowa. So this is the life of our campaign. And as you look at that, there is a red line at the top that represents the national stillbirth rate, and the teal dots and resulting trend line, where what you see there, that is the Iowa rate starting in 2003 and going through 2022. So where that blue dot meets the red line at the top, that's 2008. That is the year that our campaign was initiated. So as you can see, a trend line goes down from there. It's also important to note that the majority of the United States remained pretty stagnant while our rate was decreasing. You can see, though, that there is some little bit of variance there. So sometimes we have fluctuations in data, which is why it's really important to look at a longitudinal perspective. Things like the COVID pandemic, a syphilis outbreak, other outside factors can definitely cause some variances in that data, some spikes. And another thing that we want to highlight is that when we look at racial data for this campaign, Iowa's African American stillbirth decreased by 39% in the first 5 years of our program, which is pretty significant. So we have had the results of our campaign have been published. We have been published in the British Journal of Obstetrics and Gynecology and the American Journal of Obstetrics and Gynecology. And so when we look at the evidence, when we're able to speak with groups about this, these are the campaigns, these are the research articles that we highlight. So you're free to scan this QR code or scan it when I send it over to you. We've also just recently published an article about the implementation of our program. So this journal article, I am one of the authors on there. This talks about the critical role of standardizing fetal movement monitoring. So as we've launched this campaign in Kentucky, we really want to work to make sure that everyone who's receiving this information is sharing it with the expectant parents that they work with in the same way, and that we're implementing some of those same strategies that we did in Iowa to see a reduction. So again, this is a QR code here that you are free to scan that article and take a look at that. But just want to highlight the importance of standardizing this campaign to maximize the results. And finally, one piece that sometimes we hear from providers that they are worried about the anxiety that they might see in expectant parents. If they are constantly monitoring, isn't that going to make them more anxious about things? Well, we have looked at several different studies, have looked at our data from our app users. And 84% of those app users stated in a spring study last year that they felt like the regular tracking was associated with feelings of bonding, and 77% of those app users reported feeling less anxiety about the fetal movement that they were hearing and while they were using the app. So these are important research points and evidence that share with everyone that this campaign is really important. Fetal movement monitoring is a really important part of the puzzle.
Okay, so now we'd like to talk about our amazing materials. So as we talked about before, our goal is to replicate that strong stillbirth reduction rate that we've had here in Iowa in Kentucky. And the core of how we do that is with our Count the Kicks materials. So thanks to our partnership with Anthem Foundation, we have free materials for Kentucky providers. We have posters, app cards, brochures in English and Spanish. We have our traditional brochures like you'll see on the screen that are the yellow. And then we also have the at a glance posters and brochures in English and Spanish like Sarah showed you before. So we're going to give you some time now to go to our website or scan this QR code, place an order right now. There will be a giveaway for a $25 gift card to a random person that orders materials during this presentation. So again, we're going to turn on some music. Go ahead, go to our website, countthekicks.org, click on order materials, click on the state of Kentucky, and you can place an order for free.
Wix gives you the power of AI to build the website you need.
But first you have to have an ad.
With full business functionality.
There we go. Maybe. There it is.
It might seem crazy what I'm about to say. Sunshine, she's here. You can take a break. I'm a hot air balloon that could go to space. With the air, like I don't care, baby, by the way. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Here come bad news, talking this and that. Well, give me all you got and don't hold it back. Well, I should probably warn you, I'll be just fine. No offense to you, don't waste your time. Here's why. Because I'm happy. Clap along if you feel like a room without a roof. Because I'm happy. Clap along if you feel like happiness is the truth. Because I'm happy. Clap along if you know what happiness is to you. Because I'm happy. Clap along if you feel like that's what you want to do. Bring me down, can't none bring me down. The love is too high. Bring me down, can't none bring me down. I said, bring me down, can't none bring me down. The love is too high. Bring me down, can't none bring me down. I said, clap along if you feel like a room without a roof. Clap along if you feel like happiness is the truth. Because
I don't know about you. I could go all day long on that song. How about you, Hybels?
Same.
day
I love
long.
that song. I play it all the time and my kids get super annoyed. Thank you everybody for those orders. Again, there's still going to be time to order and be entered into that giveaway for the gift card. And please share our website with your coworkers, with other community advocates and providers so they can order materials too. So here's one more baby save we'd like to tell you about. This is sweet Mabel. And Mabel's mom, Megan, said the only red flag that there was a problem with my pregnancy was my daughter's change in movement. I'm so grateful I had the concrete data from the app, which gave me the knowledge that something was off and the confidence to advocate for myself and my baby. So we're so glad that Megan was using Count the Kicks in order to get Mabel here safely. And we'll talk a little bit more about why movement matters and how to count here in just a few minutes, but I'm going to turn it back over to Coleman.
So as part of the Hear Her campaign from the CDC, there are 15 urgent warning signs for pregnant women, and you may be familiar with them, but we want to call attention to the fact that the importance of paying attention to babies' movements is one of those key warning signs. So the CDC knows that paying attention to babies' movements not only acts as an early warning system for babies, it is critical to alert mom to issues that may be happening with her own health during pregnancy. So we can possibly have an impact on outcomes for mom and for baby. We know that babies are just like adults, and that if they're not doing well, they're going to move differently. They're going to become weaker. As adults, when we have the flu or COVID and we want to lay in bed or on the couch, it's kind of the same thing with babies. If they're unwell, their movements will change. And that is what makes a change in movement an early warning sign. So we recently collaborated, for any of you who are nurses on the call, we've recently collaborated with A1. At the beginning of the year, they released a practice brief on reduced fetal movement. And so this is really important. The practice brief aligns seamlessly with the Count the Kicks campaign and states that focused assessment and management of decreased fetal movement or significant changes in fetal movement patterns by perinatal clinicians is essential for improved fetal outcomes. So we invite you to take a look at this practice brief by scanning that QR code and kind of add to that body of evidence and also to the standardization of this campaign. And for any of you who work with Title V funds, if you are a health department today and you are listening to this information, the HRSA has recently announced a new national outcome measure that is focusing only on stillbirth. So in that 10th edition of the Title V Maternal and Child Health Services Block Grant to States Program Guidance, there is a specific call to engage in stillbirth prevention programs. And I'm going to tell you what page it's on so you know. It's on page 91. So Count the Kicks can help you report back to HRSA on how you are using Title V funds to reduce stillbirth and to save lives. So this can be aligned with those assessments that states are doing right now. And backing up to evidence, this is just another organization. And again, we talk about all of these organizations in our launch because we know that this is our opportunity to introduce the campaign to many different individuals who are working in different areas of practice. So if you are associated with AMCHIP has named Count the Kicks as a best practice in 2021. After a thorough review, they determined that our program meaningfully engages stakeholders at all levels of practice. It ensures improving health equity as an integral component of overall program sustainability and has been externally validated by another entity and replicated with similar positive results in another context. So just another plug for that. And talking about those outcomes for both the expectant parent and baby, our organization has issued a white paper on the connection between stillbirth and maternal mortality and morbidity. And this report includes firsthand accounts from women who share how speaking up about a change in their baby's movement not only helped their baby have a safe arrival, but also identified and addressed pregnancy complications that put their own life at risk. So according to one study, more than 15% of maternal deaths within days of delivery occur in women who experience a stillbirth. So let me say that one more time. So according to one of our studies that we reviewed, more than 15% of maternal deaths that occurred within days of delivery happened in a woman who had experienced a stillbirth. So again, we know that there is an impact that can be had by monitoring movement for both the expectant parent and the baby. And a recent meta-analysis that came out in 2023 analyzed data from 18 studies and found that encouraging awareness of fetal movement may be associated with reduced adverse neonatal outcomes such as decreased rates of NICU admission, the decreased APGAR scores at 5 minutes, without an increase in rates of cesarean birth or induction. So that's something else that we highlight is that this goes beyond stillbirth prevention. It can also, there's other ways that this campaign can have an impact on a pregnancy outcome.
Okay, so now we're going to talk about how to have a movement monitoring conversation with expectant parents. But first, it's important to understand, why does movement matter? So movement is a way that baby is communicating before birth, and a change in baby's movements can be an early and sometimes the only warning sign that the baby may be in distress. So just like Sarah said, when we're not feeling well, when we have the flu, COVID, or a cold, our activity level is going to change. We're going to lay in bed. We're not going to be exercising or doing our daily activities. We slow down and babies' movements become weaker. It's just the same when they are in distress. When they're not feeling well, they're naturally preserving blood flow to their vital organs, such as their brain and their heart, to self-protect, and therefore those movements are going to slow down. So when should an expectant parent start monitoring baby's movements? ACOG recommends to start counting at 28 weeks of gestation or 26 weeks of considered high risk or carrying multiples, because this is when research has indicated that a consistent movement pattern has been set that expectant parent can feel and track. And then what movements should we track? We want to track rolls, kicks, jabs, punches, pushes, really any movement except for a hiccup. We're not going to count hiccups because hiccups are involuntary. So now, how do you have this movement monitoring conversation with the expectant parents that you work with? And it's easy as these 5 steps. So number 1, we want parents to monitor their baby's movements with our free Count the Kicks app. And we'll talk about that more in just a minute, as well as our web-based kick counter, or we also have paper movement monitoring charts. And we'll put a link to, it looks like Coleman already put a link to the charts in the chat, and we have those in 12 languages. More are coming very soon. We want those parents to count baby's movements every single day at the same time every day when baby is most active. So we want those parents to sit down, relax, take this time to bond with baby, maybe involve a younger brother and sister or partner or family member, get to know what's normal for their baby. And then we want to time, how long does it take that baby to get to 10 movements? And we also want to know the strength of those movements. And please keep in mind that every baby is different and every single pregnancy is different. So just because a baby that you had before took 10 minutes to get to 10 movements, this next pregnancy, that baby may be closer to 15 or 20 minutes. So it's important to understand what is normal for that baby. And then after a few days, you'll begin to see, again, that average length of time to reach the 10 movements. And then number 5, so important. We want parents to feel empowered because they have data in hand to call their provider right away if they notice a change in the movements or in the strength of those babies' movements. Okay, so now let's talk about our app. Our Count the Kicks app is our hallmark tool. It's available in 20+ languages, available on Apple, Android, Apple Watch. You can set daily reminders to count the kicks, and you can download and share your history with a provider, family member, or friend by text or email. So this is how it works. First, when you get the app, we want you to log in and create an account. So that's important because that's how your data is going to be shared or saved. So when you want to start to have a kick counting session, again, sit back, take that time to bond with baby. When you feel that first punch, kick, jab, or roll, tap the blue footprint and the timer will begin. And then every time you feel an additional movement, tap the blue footprint. And after the 10th movement, the timer will stop. And then the app is going to ask you to rate the baby's movements, the strength of the movements from fluttery to fierce, because research has shown it's important to monitor the strength of the baby's movements as well. And then over time, as you can see at the phone image on the right, you're going to get a graph of what those babies' movements are. You're going to understand what the average length of time it is to get to 10 movements. And we want that line to be linear. But if we see a big drop or a big spike in those movements, now that expectant parent has data in hand, so they can go to their care provider, they can go to labor and delivery triage and say, hey, I know my baby's movements are off and I'd like to be seen. So please take the time to download our app, understand how easy it is to use so you can share it with the expectant parents that you work with every day. And now we're going to watch a quick video again about our Count the Kicks tools and the ease of using our program with expectant parents.
Whether you're counting on the go,
आराम से घबराइए मत.
your baby's movements matter.
Les mouvements de votre bébé comptent.
Monitor your baby's kicks, pokes, jabs, and rolls once a day.
Todos los días durante el tercer trimestre.
C'est l'occasion de communiquer avec votre bébé et d'apprendre ce qui est normal pour lui.
Bond with your baby.
Crea un vínculo con tu bebé.
सशक्त महसूस करें. Sentez-vous autonome.
Confía en tus instintos.
Trust your instincts.
Ve al hospital de inmediato si los movimientos de tu bebé cambian.
L'application gratuite Count the Kick est disponible dans plus d'une douzaine de langues.
एप्लीकेशन डाउनलोड करें
or visit counttthekicks.org for more ways to count.
देर ना करें, आज से ही गिनती शुरू करें.
No tardes, empieza a contar hoy.
Ne tardez pas, commencez à compter aujourd'hui.
Don't delay, start counting today.
Great. Now I'd like to talk a little bit about our web-based counting platform. I just put a link to this in the chat. So this is a way that expectant parents can count their baby's movements on a desktop or laptop computer. Maybe they want to They want to count their baby's movements at work, or they're at a friend's house or a public library. They don't have access to the app. They can log into our web-based kick counter and go into their account and have a kick counting session. So please share this with expectant parents. Another resource we have is our Find Local Resources page on our app, and this is where we can connect expectant parents to free and reduced cost services in their area by zip code. So we want to connect people with resources before a baby is born. So people can search for dental care, diaper banks, WIC clinics, and much more. And this is a completely free resource on our app.
Okay, so let's talk about the implementation of Count the Kicks into your specific work. So we want to just talk about the provider's influence. So whether it's a midwife, a doula, maybe counted as a provider here, physician or community health worker, sometimes even WIC clinics. We see as community health workers and specialists that increase this conversation. But just know that as a provider, so the provider's influence is really strong, and they need to hear from you why tracking fetal movement is important. So those physicians and those midwives, they need to hear from you why tracking fetal movement is so important. And you can see here from the data that 87% of those app users that we've surveyed say they would contact their provider about that change if their healthcare provider had encouraged them to speak up. So this is really important. And having that knowledge as a community health specialist is also really important to just talk to providers in the conversations you're having. Are you bringing up Count the Kicks with people in the third trimester? Again, I'll point to Kathleen's story. I'm so glad she was here to share that with you today. You heard that her physician's office was using this programming, and she had already had instruction and was using the app. So it's really important. So when we talk about systematic implementation, and this is kind of one of the last big buckets we're talking about today, so thanks for hanging in there with us. There are a couple things that you can do as far as implementation in your work. So if you have an organization, if you're a clinic that has discharge paperwork, this can be integrated into electronic health systems and records as well. We have several examples here of hospitals across the United States that are doing this currently, so feel free to connect with us and ask for that information. Training a team, make sure that everybody who's going to come into contact with an expectant parent knows. So thinking about like the medical assistants that take people back and they do the blood pressure, that's a great time to say, hey, have you downloaded the app, or put one of our OB triage cards on the blood pressure card. Just zip tie that sucker on there so that when you are having a conversation about where they are in their pregnancy, hey, did you know you're supposed to do this in the third trimester? It's really easy. Front desk, order our app cards and put those app cards right at the front desk. And it's really easy for a receptionist to say, I know you're here for your 32-week appointment. Just want to make sure you're using Count the Kicks. Okay. So those conversations are really easy, but also essential to the implementation. So intake summaries, again, we have several different examples of this across the United States. Recently, we've had a huge spike in WIC clinics that are making this connection, and they are adding this to case management forms. So just thinking about any possible entry point that you have for that conversation. And then procedure wait times. This is a big one. So if you've ever been sitting and waiting for labs to be drawn, or as an expectant parent, we know they sit and they drink that glucola. If they're waiting on a provider who may be running a little bit late, or even if they're just getting checked in, again, that conversation with the medical assistant, that downtime is a really great place to say, hey, while we're waiting, can you download this app and let's take a look at this together? So that's a really important conversation that a nurse or a medical assistant can have, and just kind of help them troubleshoot using the app for the first time. We can also send over, for those of you who have a waiting room or a phone bank, we can send over an audio recording for patients to listen to that talks about the importance of fetal movement monitoring. It's less than 10 seconds. So it's not like it's a long thing. It's less than 10 seconds, and you can just kind of keep it moving on. But those are some key actions that we can assist with for systematic implementation. So just throwing this in the chat here, I won't run it as a poll today, but just giving you the opportunity to ask us, what are some questions you've received about fetal movement monitoring. We know that questions are out there. We also know that misconceptions are out there. So I'm going to pass this over to Hybels to start sharing some of those with you.
Thanks, Coleman. Okay, yeah, so let's talk about some misconceptions when it comes to babies' movement. So the first one is my baby should get 10 kicks in 2 hours. So maybe you've heard this from like a grandparent or an aunt. I think Coleman was taught this when she was in nursing school, but research has changed. So the current research is indicating that we want parents to understand what's normal for their baby. And like we talked about before, how long does it take that baby to get to 10 movements? Okay, so really important to understand, not 10 and 2, that we're just trying to find out what's normal for that baby. The next misconception is if my baby isn't moving, I should drink something cold or eat something sugary to get baby moving. So let's go back to think about when we were talking about having a cold or the flu or COVID. We're laying on the couch, we're not feeling well, our movements have changed. Well, if I go ahead and drink a bunch of coffee or Mountain Dew, of course, I'm going to have a little burst of energy, right? I'm going to start working a little, or Dr. Pepper, as Coleman likes. My movements are going to change, but that's an intervention, and that's a false representation of how I am actually feeling. So kick counts are best monitored without interventions like juice or candy. If baby isn't moving like normal, again, we want parents to feel empowered to speak up to their provider right away. And so we talked about some misconceptions, and we know there's a lot more out there. And we know also that one place that people get their health information is on social media. So please feel free to share any of our posts on social media. Follow us on Facebook, Instagram. We have a fabulous social media manager that puts great content out there. And we'd like to show you this video from Jen Hamilton. She's a social media influencer and a labor and delivery nurse. And we woke up one day and she had posted this amazing video without our knowledge. And we're just so grateful that she did. But she's great about dispelling a common myth about using Dopplers at home. So let's go ahead and take a watch.
Did you know that there's an app that can prevent stillbirth? Studies have shown that the most reliable indicator for an intrauterine fetal demise or stillbirth is a change or decrease in fetal movement. And getting to know your baby's movements and letting your doctor know if you have any changes is a great way to protect your baby. You don't need an at-home Doppler, and in fact, I would highly discourage you from buying one, because sometimes what happens is you can notice a change in your baby's movements and you can put on the Doppler and hear a heart rate and be like, whew, everything's fine. And if you were put on a monitor where we could see what your baby's doing, we would see fetal distress. This is a baby that's doing great. This is a baby that might not be doing great. And this is the baby that's definitely not doing great. But guess what? Every single one of them has a heart rate around 150. And with just hearing a Doppler, we don't know which one of these is your baby. There's a free app that you can download called Count the Kicks. It is a way that you can monitor your baby's movements, and it'll help you figure out if you might need to go get medical attention. I don't work for Count the Kicks. I get $0 for telling you about this. I just think that this is genius. They were able to decrease Iowa's stillbirth rate by 32% in the first 10 years of the Count the Kicks campaign. So please, take a few minutes each day and just pay attention to what your baby's doing. And if your baby's doing something wonky that they haven't normally done before, come see us. We would so much rather you come in, we monitor your baby, we maybe do an ultrasound, and we let you know that your baby's doing okay, than for you to not come in and your baby not be okay. You aren't bothering us, okay? We want you to come in. That's what we're here for.
Okay, so we're going to wrap this up. We want to just kind of highlight a few next steps. I just love Jen Hamilton. So familiarizing yourself with the Count the Kicks app is a really important thing that anyone can do. Practice using it. It is fairly easy, but sometimes people have a hard time with technology. So know how to troubleshoot things. Also, familiarize yourself with the resources. And I would be remiss if I didn't say these resources are being provided to you free in the state of Kentucky. It's a wonderful wonderful bank of resources, everything that we're sharing with you today. So again, thank you to Anthem for funding this campaign. We're really, really grateful to bring that to you in Kentucky. Again, you can order materials, get those orders in today to be eligible for that gift card. But then maybe if you're in a practice, designate somebody to keep their eye on the materials and see what's working the best for your clients. Maybe they like the at a glance better than the traditional. Just kind of keep an eye on it. Take time to educate. So this is a really important step. When you're working with expectant parents, make sure that you're having the kick counting conversation at every touch point in the 3rd trimester. Stay on it, stay on it, stay on it. And make sure your entire staff knows about the campaign and the importance of tracking fetal movement. Debunk those misconceptions and encourage speaking up. So when people have questions, let's get them to the right resources. Let's get them to providers to help them understand what their options are. And always, we always want them to connect with providers to get the most important information for their pregnancy. And remember that hours and minutes matter in preventing stillbirth. Going back to Kathleen's story again, it's so important. You heard her say, she just asked if she had time to call her husband before she went back for a cesarean section. So hours and minutes matter when it comes to preventing stillbirth. So make sure, and Kentucky is a rural state, and I'll give this little question for you to consider. If you know that your patients that are coming to see your providers have a distance and a ways to go, then that's probably worth a conversation with the provider. What do you want us to do if we get a phone call from someone who's going to have a 2-hour journey in? Do you want them to just go straight to the hospital to be monitored? Do you want them to wait for a nurse to call them back? What is the protocol when we're thinking about our patients that will have an access issue? With that equitable access is not a guarantee. And so maybe they have transportation, they have to wait on a bus to get somewhere. What do you want them to do? Be ahead of that conversation as a team. So we'll provide you with some resources on our way out, and I'll pass it back to Hybels after showing you this cute little baby in her bonnet and her Count the Kicks onesie.
Okay, so again, our free educational materials, place those orders today, posters, app cards, and brochures in English and Spanish, as well as our at-a-glance materials. And we have put a link in the chat for the web-based kick counter and the printable kick counting charts. There's also tons of videos, FAQs, and lots of other information on our website. So please feel free to go to countthekicks.org to learn more. And if you really want to dive deeper into how to have movement monitoring conversations with expectant parents, we do have this CE training. So you can scan this QR code and sign up for training at a low cost and just dive deeper into what we've been talking about today during the webinar.
So finally, we just want to encourage you to engage with us so that you can stay up to date on the news that's happening in Kentucky and across the United States. We highlighted that the federal government has passed the Maternal SPA Act, Stillbirth Prevention Act. This is going to impact things greatly in a great way for us. And so if you want to stay on track with what's going on, you can follow us on our social media accounts. Just know that the Healthy Birthday is a little more advocacy focused, and also things that are going on in our organization. And the Count the Kicks materials, which all of this is completely shareable, are really based on getting engaged with an expectant parent audience. So we encourage you to follow us on those channels and to sign up for our newsletter. So in closing, again, just want to thank the Anthem Foundation for providing us with the funding to do this campaign. And we just want to say thank you for being here today. Hybels and I will remain here for a couple of minutes. If there's any questions anybody has for us, we'd be happy to answer those questions. Otherwise, thank you for joining us today on this Friday in August and spending your time with us to learn about things. So have a great day, everybody. I am going to pause our recording.